Prime Minister Jacinda Ardern has confirmed New Zealand will move to the red traffic light setting at midnight tonight. 9 COVID cases in Motueka are confirmed to have the Omicron variant, prompting the decision.
That means Omicron is now circulating in Auckland and possibly the Nelson-Marlborough region, if not elsewhere. On that basis, as we have previously signalled, the whole of New Zealand will move into the red setting of the traffic light system at 11:59 p.m. tonight, Sunday, 23 January.
It comes as the Ministry of Health announced 24 new cases of Covid-19 in the community today and 47 cases detected at the border. Every region will move to the red setting, regardless of whether that area had a confirmed Omicron case. And Ardern said she expected the country would stay in red for some weeks.
Our plan is simple. Get boosted. Wear a mask in indoor settings and outdoors when you can't distance from others, and reduce contacts as much as practical in those environments.
Red is the most restrictive traffic light setting, but domestic travel can continue. There would be no more borders around regions. In red, face coverings are mandatory when travelling on public transport, in retail, and to an extent in education. Public facilities and retail outlets are open with capacity limits. Despite Omicron, schools will still open as planned. The government will be taking a 3-phase approach to the point where New Zealand sees 1,000 cases a day.
Phase 1 will include the period we have up to 1,000 cases a day or less. We expect this scenario in the initial stages of the outbreak and could take up to 14 days to arrive. At this stage, we're doing what we've successfully done with Delta, taking that stamp it out approach, and this will be familiar to you. Broadly speaking, it includes the same contact tracing, isolation, and requests that everyone who has symptoms be tested at a community testing station or at a primary health provider. If you're required to isolate during this phase, you'll receive advice and, if needed, support to do so. In this stage, you will need to isolate for 14 days if you're a case and 10 days if you're a contact. Stage 2 will be a transition stage where we adjust the system to focus much more on identifying those who are at greater risk of severe illness from Omicron, which will be a smaller percentage of cases. At the third stage, when cases are in the thousands per day, we will then make changes to contact tracing, the definition of contacts and isolation requirements. Details of this stage of the outbreak we'll be providing in a full walkthrough with the Ministry of Public Health on Wednesday.
Deputy Prime Minister Grant Robertson said if businesses follow public health measures, they could remain open and the economy will continue to operate strongly.
It is important to reiterate, at the red level, this is not a lockdown. It is not what we did under the higher alert levels. And if we all follow the rules and the health guidance, the economy will continue to be able to operate strongly and businesses will be able to open.
Prime Minister Jacinda Ardern has cancelled her wedding to partner Clark Gayford. The pair were planning to get married this summer in Gisborne.
I am no different to, dare I say it, thousands of other New Zealanders who have had much more devastating impacts felt by the pandemic, the most gutting of which is the inability to be with a loved one sometimes when they're gravely ill. That will far outstrip any sadness I experience.
Meanwhile, National Party leader Chris Luxon addressed media in Orewa this afternoon. Luxon said rapid antigen tests were needed urgently, and the country currently had less than 1 such testing kit per person in New Zealand.
Rapid antigen testing is a big problem for us in this country because once Omicron takes hold, our testing will be overwhelmed and we need to be able to make rapid antigen tests available. And the reality is, with 4.6 million only in the country, that's less than 1 per person. We need tens of millions of them. And the government has been, companies have been reaching out to them for a long time, and now we're in a place where we actually don't have what we fundamentally need. So whichever way you look at it, it is disappointing. It's been a very slow response and I think we are unprepared.